Question or a comment? When someone questions me on autism,
Hello.
I have these details.
Thank you, Prof. Ali, for this nice talk. My question is about, because in our practice, we see a lot of patients with diagnosis of spectrum versus autism disease. And as you said, a lot of patients who's been in front of the TV using mobile phones with all those symptoms, but it's not autism. It's a problem of lack of training of their brain for speech and so on.
It is not that straightforward. The thing is, there are almost every child is fond of the mobile phone now. You know, a 4-month-old can also look at the mobile phone. It doesn't mean that that child is going to develop virtual autism. For some reason, some children get very close to the mobile phone and it is very addictive. That is where he loses touch with his parents. He's so fond of that mobile phone that the mother calls him and says, no. So for him, that mobile phone is the mother. But you're not home. The only thing that is at home is the mobile phone. So it is not a great practice, but people do it. So this type of induced autism is called the virtual autism. And because there is no neurodevelopmental trauma, there are much better chances of treating them. You have a question?
When you talk about the genetic aspects, is there...
Yes, it's working.
Is there a chromosome that you have identified, or genes? Like for Angelman syndrome, it's on a chromosome 15. We know it's on the long arm, the maternal long arm, that the UB3A enzyme ubiquitin is missing, and that's why I'm gonna have the
disease.
The disease, yes.
Yeah.
We talk a lot about the chromosome 15 for also autism. When we say it's the opposite, the UB3 is overactive.
Yeah, what I was trying to say was it's not monogenetic. That's the problem. That's why the experts on genes are struggling, because it's polygenetic. There's thousands of genes that seem to be involved. It's just not one chromosome or one gene. This is the problem with this. If you have more, then this is what I know. But I think this is because it's polygenic. Okay. It is more difficult to analyze.
Right.
Thank you very much,
Thank you.
Dr. Arif. I'm trying to work out what we call autism in Kinyarwanda. So, autism baita gute mu Kinyarwanda?
Do you know the prevalence of autism in Rwanda? Can anyone tell me?
No, there's not.
Can anyone tell me
There's no word.
Yes,
There's
I'll
no
tell
word.
you. I'll tell you. The prevalence of autism in Rwanda is 400 children to 100,000. 400 children to 100,000 children. That is what they found in Rwanda. So you can go and check up. This is what I've read. But you can always...
One more question.
One more question? Yes.
Hi, good evening. Okay, I have a question about autism, because for us we have...
Take your mic closer.
For us we have a parent group. So sometimes you find out when we talk about what might be triggering the parent or what triggered the autism, some of them tell us like they think that they took a lot of alcohol because when they were pregnant, they were taking a lot of alcohol. And recently in 2024, I was diagnosed with ADHD, of which I'm still wondering what triggered it, because I was like, at this age, why should I have ADHD? It's still...
Yeah, I think what you're trying to say is that mothers with alcoholism are more prone to give life to children with autism. Is that what you're trying to say?
Yeah, that's what they were
So
saying.
are you
yeah.
trying to say that the child's brain is traumatized when an alcoholic mother gives birth to their child? I don't think there are very many studies, because there's so many mothers who are alcoholic, and they give birth to normal children. Yeah, exactly. So it is polygenic and multifactorial. So we still do not know. We know there is a strong chance of inheriting the disease, but again, there's still a mystery, right? Thank you.
And again, why do we have adults? Like, why do adults like, you just find yourself with ADHD when you're at your age, like from 30 to 40 something?
You mean adult onset autism?
Yeah, on ADHD. Sorry.
That's a very good question. I personally believe that I'm sure there is some gene somewhere which is not as intense or strong, and that's why it's coming later. Yeah.
Thank you very much.
Thank you.
Can
Thank
you
you.
please thank Dr. Arif? Thank you very much. I think I've read about, like I said, my background is education, and we do have students who come presenting with other symptoms which are not ADHD, or students who are not on a spectrum. And when we ask the parents, when we've done investigation, it's alcohol fetal syndrome, when the parents have been drinking a lot. So alcohol fetal syndrome, they present with that, which is completely different to ADHD. I'm going to invite Dr. So, where's my program? All right. So this is a case study from Burkina Faso, and the managing of neuromyelitis optica spectrum disorder. And this is going